you have already submitted your applications or about to submit your application, the focus now shifts on interview preparation. And we are glad to have Dr. Watts from Cook County. And she's a program recruiter. She's an attending, so a very good person to discuss interview preparation, what programs are looking for, and how you should prepare. So welcome again, Dr. Watts. Glad to have you. We're always excited to have you with our students.
Thank you. Glad to be here.
So, Dr. Watts, as we start the interview preparation season, the burning question every student has is, how do actually programs select the applicants? So maybe we can start with that.
So how do we select the applicants? Whoa, that is a big question, right? So it's always a team effort. So recruitment committees usually consist of a significant number of members of the committee from various parts and aspects of the department. And programs can have different approaches, but for the most part, they're pretty similar. Oftentimes, the program directors may do a first pass through the entirety of all of the applications and then assign or distribute numbers of applicants to each program on the team in order to better kind of filter down. And then other programs may just distribute them all amongst the team without the program director kind of filtering through first. After that, of course, we look at a lot of the objective information, right? So that's going to include test scores and graduation dates and things like that. And usually the program committee members will go through the individual applicants that they have been assigned to, and will do deep dives into their CVs, into their personal statements, into their LORs, and really try to get a good idea of who the candidate is. That's really what we are trying to find out. Is this someone that we want to work with and that is committed and invested in someone that will be a good fit for our team, in that we're all colleagues and all team members.
Okay, thank you. That was a great insight into how programs work. And now the broader kind of themes. What are some of the topics, themes, categories that the students should be prepared for as they interview? So I won't necessarily say questions, but what are the things that students need to be prepared for in the interviews, and how do you recommend they start this preparation?
Students need to be prepared to speak about themselves in a positive light. They really need to be prepared to sell themselves. Basically, you need to sell why I should choose you for an interview over someone else, why I should really consider working with and teaching you and adding you to part of the team over someone else. And not from a standpoint of necessarily, bringing down another person, but just how to elevate yourself, how to answer all of the questions of why you would be a good person to work with, why you would be a great person to teach, why you're going to be good for my patients. So students really need to be prepared to speak about things that aren't related to their exams, that aren't related to their grades. They need to be able to speak about their passion for the discipline that they're applying to. They need to be prepared to speak about their leadership skills, their ability to be a team player. They really need to sell who they are. That has little or nothing to do with their scores and their grades.
Okay, so just so that I can paraphrase this, so leadership skills, teamwork skills, clinical acumen, empathy, or with the patients, how they interact with the patients and other team members are some of the things, and not so much just flaunt their grades or test scores and things like that. Okay. Now, most students tend to stumble on this easy but yet very complicated, tell me something about yourself, So this landmine, how do you, and I know there is no one answer to it, but what are the programs expecting out of this? Tell me something about yourself.
Right. So what we're looking for, I mean, of course, the content is important, but we are looking for them to be able to easily discuss an aspect of themselves that would relate to why they're going to be a good doctor, a good employee, right? A great physician, and again, a great colleague. So we are looking for, they should be able to speak about themselves easily as a physician, right, you're responsible for advocating for your patient. Sometimes that even means advocating for yourself as it relates to what you're doing in terms of your patients. And you should be able to speak easily. So we are looking for communication skills when we're asking that question. And they should be able to, whether it's tell a story about themselves that ultimately culminates in them, being compassionate or them learning from whether it's an adverse situation or them obtaining new information in some format or them helping someone. They really should be able to talk about anything about themselves and how it relates. And it doesn't even have to necessarily be medicine. Someone who has a interesting hobby or an interesting activity, and they can talk about what they learned from that. Hey, they're a great soccer player or cricket player, or they were on a team that never won, and how did that help them grow as a person? So they should have a story ready that ultimately will, one, it'll help me to remember them, especially if it's a very interesting story and something that they noted. And it also shows that they have insight about themselves. As a learner, they are not going to get everything right. I mean, none of us do. And so it's, how do you deal with mistakes? How do you deal with difficult situations? So though it's definitely, and I love asking that question on the interview trail, because it really, gives me an opportunity to see how they're going to respond. And so it is a great question, and yes, they should definitely be prepared to answer that.
Okay, thank you. So now we are getting some specific questions. One is, many of students, as you know, over the past 1.5 years have only done telerotations. And then the question is, how do I talk about my telerotation experience and what are some of the tips that I can use if I've done telerotations?
Yeah, so that is something that I think is really important to understand. This concept of virtual rotations versus in-person and hands-on rotations, that is something that is a big deal in the candidate's mind. It is not a big deal in our mind.
Hmm.
What we want to know, because all of us, all of our learners, we recognize have had to learn in a virtual format. And overall, all of us have actually kind of come to appreciate the level of interaction that the virtual format provides that we don't necessarily have in the in-person format. So there is nothing negative, if I can use double negatives, about telerotations. They are great. And so they should speak to them in terms of, as you should any rotation, what did you do? What did you learn? What skills were enhanced? What did you practice? What were some of the challenges in terms of delivering care from a tele-based standpoint? What other skill set did that mean you had to lean heavier on that you didn't imagine you would have had to have leaned on if you were in person with a patient? So they really should talk about any rotation, whether it's telerotation, whether it's in person, whether it's in a hospital or on a clinic. It all should come from a place of, what did you do? What skills did you learn? How did that enhance your entire view and understanding of medicine, the delivery of care, and patient interaction? People, I know that the students seem to have a little bit of a, oh, I was limited because it was virtual. It is not a limitation. It is another platform, another format for delivering care that a lot of patients were actually very, very happy about. So they really should talk about telerotations, not from a standpoint of, oh, I just couldn't do in person because of COVID, it was I sought out this opportunity and this new platform and this innovative way to interact with patients and to be taught. And this is what I learned from it. Everything they should be prepared to talk about, everything they have done from a place of, again, how it makes them a better candidate, what it did for them for learning about medicine, delivery of care, and patient interaction.
Okay, thank you. And maybe a related question. So many of the students are asking, should I continue to do, if I'm in my home country or even here, should I continue to do rotations even after September 29th? Is that going to be beneficial or should I not? What is your perspective?
My perspective is yes, it would be beneficial, right? I don't want the learners to look at it seems like they limit the way that they're looking at their rotations as
Yes.
if they're not doing it in the States or if it's not going to result in LOR, then it's not valuable. And that is not true. When you're a resident, you're going to be seeing patients every month, all the time, no matter what's going on. So, yes, you should definitely still continue to pursue clinical experience. You have to look at this in terms of enhancing and improving your skills. The more patients you see, yes, the better you'll be. Absolutely. Everything is about exposure. So, I can't imagine a negative aspect of doing continuing to do a rotation. That is your future life. And if it seems that you're just stopping with rotations because the application season has started, then that does not speak to much commitment to me, because I'm confused as to why you would stop doing clinical work if your goal is to do clinical work. So this should not be a task based approach or motivation, or I'm just going to checklist seeing patients so I can get my application in. I expect when I'm looking at your CV and when you're at an interview, I expect that you're still doing things clinically. That's if you're telling me this is what you want to do, this is what you should be doing.
Okay. Another question is about either attempts or low scores. Should the students bring that up themselves? Should they wait? Or how does this, what is your opinion,
So,
perspective?
right. So my opinion is that in terms of failed attempts, I do think that that's something that needs to be addressed in your personal statement. You don't need to go into the detail, but you definitely need to acknowledge it and acknowledge what you learned, how you improved, what was the problem. If it was just that, hey, I thought I was a great test taker, this was a test I had never done before. And then when I took it, and I was unfamiliar with the format, what did I do after that? I sought out additional, that same format. I, timed myself, whatever it is, it needs to be how you got past, how you overcame that adversity, not an excuse. I'm not looking for an excuse. My dad died and I was too depressed. And while of course grief, is definitely real for a true loved one, you need to still speak to how you dealt with that, because right, grief is an ongoing thing. So what did you do? Oh, I realized that, my mom, I lost her, but she was and always encouraging me, and I took that into my preparation, and it made me determined to show her that I could do this. So it needs to be it needs to come full circle in terms of this was the adversity, and this is what, again, insight, what I learned from it and how it made me a better person. As far as low scores, I don't necessarily think that if you pass, you necessarily need to address that your scores are low, right? One,
Mhm.
because it's a variation in terms of what is low for different programs. A lot of programs, many programs, may not really care in terms of what your score is. They're looking for a well-rounded person. So failed attempts, I think, definitely may need to be addressed. But low scores, what you need to do is highlight and elevate everything else in your application and show how you are so much more than your scores regardless. And that's the same for people with high scores. You can't just expect your scores to get you in. I don't, care how high your scores are. I am hiring a person, not a set of numbers.
Yep.
And unless like someone else is going to address the low score, or the failed attempt, if someone else in LOR writer or your dean or someone else, if they're not going to address a failed attempt, then you should. But if someone else is addressing that in like your dean's letter, where that might be the case in some people's situations, then you probably don't have to explain that again. But you do need to speak to what you learned from that adversity, and what you're doing to go forward and make sure you were improved.
Thank you. Questions are again coming in. One of the questions is applying to multiple specialties. What's your thought on that?
So, what I would say is, as someone who teaches IMGs on many levels on a regular basis, and also who, I do love statistics, I can appreciate the strategy of applying to multiple specialties. No problems with that. However, when I am reviewing,
I think we lost her. Okay, we'll as soon as she joins, we'll start with her. But let's answer some of the other questions as she's. So I think Mohammed, she's answering that question. We may have lost her, but let's give it a minute. If someone went into research instead of clinical work after graduation, is that still bad? That's not bad. I mean, they will want to see your internship, maybe electives. So if you can demonstrate enough of clinical acumen, maybe as she was saying, telerotations, that should still be able to get you through. I don't think research, in fact, a lot of programs will appreciate research, so that shouldn't be a problem. Okay, I think she's connecting back.
sorry,
Dr. Watts,
sorry. You guys hear me okay?
yes, you're very okay. Yep. So yeah, you were talking about multiple specialties. Looks like
application other to the multiple specialties. You just really have to make sure that it speaks to that specialty. So oftentimes people ask me for a general letter of recommendation because they're going to apply to multiple specialties, and that's fine. But what I tell them is a general letter as opposed to a personalized letter. I mean, a letter specifically for pediatrics, I'll say, I recommend this person to your pediatric residency program. I am writing this letter, to endorse their candidacy for a residency in pediatrics. A general letter will just say, yes, I recommend them to your residency program. They will be a good clinician as opposed to a good pediatrician or a good internist. So there's definitely some subtle differences that I can recognize on the recruitment committee and looking at all of these LORs that, this person is, might be hedging their bets with the general letter. So everything else in your application really should speak to why you're applying to that particular specialty. If there's anything in there that suggests you're applying to multiple specialties, that is not going to be looked at favorably. However, I definitely think that is a perfectly fine strategy. I understand why. You just need to make sure you take the time and address the detail of your applications for each of these disciplines, and it speaks to those disciplines.
Thank you. Another question that has come in is it okay to discuss with the program director or other interviewers that it was the financial situation that prevented you from applying, and that's why you're applying maybe later as a not as a recent graduate? So are these things okay to discuss, that you had financial problems?
Oh, absolutely. Absolutely. We know that this is an expensive process and it is actually way more expensive than it was when I was applying. That's for sure. And so that is fine. That is not a problem. Finances are a real concern for everyone. But again, it should be reflected in your whole application that you were working or doing something to earn those finances in order to be able to pay. So I know that some people think that they shouldn't mention non-medical, non-clinical, non-medically relevant jobs in their CV because it's not medicine, and that is not true. It's gonna look like a gap, and I'm gonna, wonder where you got your money from, and then you don't want to leave that to my imagination of, hey, he was out selling fingers or something. So, so definitely be honest and be able to discuss the entirety of the situation. And you don't necessarily have to go into detail per se, but you should be able to speak to it in a way that seems open and transparent.
Okay. Another question, which is, let's say I'm applying to pediatrics, but let's say I have just one letter in pediatrics, the other two or three are from different specialties. How do you look at it?
That does not look well for pediatrics or for internal medicine, I would say in particular. Family medicine, you can kind of play with the ratios a little bit because you could get a letter from an internist and a family medicine doctor and a pediatrician to speak to, how you would be with that aspect of the age range of the patients, the different patients. But for pediatrics, it's basically just going to make me wonder, well, you didn't know at least two pediatricians that would support your candidacy. That does not look as encouraging. So I would say for any discipline that you're applying to, you should have at least two letters from someone within that discipline. Even if that has to be someone from your home country, that's totally fine. That is not a negative. You can do that, but you should have at least two letters from that discipline to support your candidacy. Otherwise, I'm going to wonder, why you could not find a colleague of mine, a disciplined colleague to support you in this role.
Okay, thank you. And another common question, and that just popped up, many IMGs have gaps in their med school. So maybe during internships, they were looking for electives and things like that. So how do programs look at these gaps which are during the med school?
Right. For programs, certain programs who take a lot of IMGs, we have a little bit more familiarity with the process, and we know that it's not as necessarily as straight and narrow as the American process. For programs who take a combination of American grads and IMGs, they may not be as familiar. So it's always a good idea to address those again, whether it's in your personal statement to kind of talk about how this time frame works, what you did during that time. Even if it's like a lot of learners have to do a service year after they graduate, maybe in between their graduation, their last years of graduation. You need to explain that's a part of your process in order to address the gaps. Otherwise, it just looks like unexplained time off.
Okay. Okay. As we ask I know we have only 5 minutes, but before we switch to other questions, a lot of students are starting to ask about the next season. How will the criteria change when we go pass fail? So step one, pass fail, probably next season, of course, but how will programs evaluate it differently, the applications?
Yes, I think we're all trying to figure that out. So the official word is that it, it won't make a difference. That's the official stance. But the unofficial, and what I like to think is the most likely stance, is that step two scores are just going to weigh heavier. I really think that that's what's going to happen.
Hmm.
And I think that's what students really need to be prepared for. That's, we change, it's a slow thing in medicine, and we all are creatures of habits. And so this pass fail phenomenon is an opportunity for us to change and improve and be better with how we evaluate candidates. But a lot of us are, of course, creatures of habit. And so I think that would, to position yourself in the best light, you need to be prepared for your step two score to be very important.
Thank you. And I know we promised only 30 minutes and you're very busy. So what are some of the things to avoid from a student perspective during the interviews, whether it is what they say, don't say, behavior, or what things just don't put them, they should avoid, absolutely not do.
Always be professional. Do not, even though the interviewer can be more casual, you are the one interviewing for this job. I already have my job, so, and you're not giving it to me. So remember that you must always be professional. Do not be casual in any way with the interviewer. Please don't, flirt or ask anyone on a date or ask for their personal information. Probably the biggest thing is to make sure that you are professional. Of course, the virtual format lends itself to, interruptions and things like that. Usually, my kids are always photobombing my any meeting that I have virtually. Try to minimize that, but if that happens, just really try to be, personable and laugh it off. You can say, I'm sorry, welcome to virtual life, but just make sure that your personality comes through. That's what we are looking for. Do not again, do not let this virtual aspect make you give this false confidence that we can't perceive or pick up things because it's virtual. We don't care about the way you talk to us because it's virtual. That is not true. This is an interview. This is just the same as being in person as far as we're concerned. So keep that in mind. Of course, always be camera ready the entire time. Ideally, I would say still wear pants. Remember your camera's on. Don't have on the nice top and then not be aware that your camera can show down to your favorite team's sports shorts. Uh, but yeah, that's probably the biggest thing. And just know from start to finish, you are selling yourself. Do not ask for a spot. Do not beg for a spot. I am not here to do you any favors. I've got hundreds
Yep.
to thousands of applicants. So, all of you beg for a spot that's easy for me to kick you all out. I'm not trying to do you a favor. You need to convince me. You need to sell yourself to me as to why you want to be in my program and why I should fight for you in our recruitment meetings, because that's what the role of the interviewer is. I'm the one who knows you the best and the most. I have all your information and I've met you. So I am going in there equipped to fight for you, to fight for your spot. So you need to make sure you equip me and position me in the best way to effectively fight for you.
Well, thank you very much, Dr. Watts. That was very, very impressive and very motivating. And I think this is one of the biggest mistakes IMGs do, whether it's lack of confidence or whatever. But yes, they come across as begging, and yes. So I think this advice is very well taken. The confidence has to show through, and they have to, show that they deserve the spot, and the interviewer can be their champion.
Yes, absolutely.
Yeah. Thanks again, Dr. Watts. Thank you for taking time from your busy schedule. And again, see you maybe in a few months on the next webinar topic.
Absolutely. You're so welcome. No, thanks so much for having me. I really enjoy these. Sorry about my Wi-Fi connection glitch, but again, life in virtual.
Yeah, thank you. Thank you.
Awesome. All right. You all take care.
Thank
Good
you
luck,
so much.
everyone.
Yep.
Bye-bye. All the best.
So we'll continue with the questions that we are getting. Thank you again, Dr. Watts. So let me take some questions. How many electives do we do if we want to get into Mayo Clinic Rochester's internal medicine residency program? So very specific. Any program like a competitive program, Mayo, Cleveland Clinic, high scores, recent graduates, those kind of things. If you have some research, that always helps. Do you think signaling will affect sending interviews and ranking applicant? Dr. Rafiq is asking. We don't know, right? This is the first time this has happened. You can only signal 5 programs. In our opinion, this will mostly be from an AMG perspective, but we don't know how programs will take to signaling. Programs are aware that IMGs apply to more than 200 programs in IM, for example. So don't know, don't worry about it. How do programs look at old IMGs with home country residency? So home country residency is very powerful. Our students with home country residency tend to do very well because they can showcase the experience and the skills that they already acquired, whether it's working under stress, working with other team, leading the team. It is very valuable. The only challenge you have is to demonstrate and talk about it, or articulate it well, but that's a very good skill if you have home country experience. Will personalized personal statement ways sending interview? So I think the question is, should I personalize the personal statement for each program? And the answer is, it becomes unwieldy, especially if you have 200 programs. As long as you don't get confused and you don't send the wrong personal statement to the program, we generally say, your top 10 to 15, if you want to personalize, that is fine. It may not be worth personalizing 150 personal statements. What would be the impression if I send my PS and CV to a program director directly and as well as through IRAS? So sending directly may not be the right way. I think you still need to apply through IRAS, obviously, and then you can follow up as during the season, right? So sending to the program director, remember that this is the season, or in every season they get, especially say internal medicine, they'll get maybe 200, 2,000 to 3,000 applicants in the first few days. How many program directors are actually going to look into it on first day? Not many. So probably go through IRAS and then you can do the outreach later on. Okay, other question. Do programs look at old IMG? We already answered that with the residency. I have only one research experience. How will this affect my CV? So research is good to have. That is not a requirement. One is better than none. So I think there are other things, obviously, in the profile that they will look for: your scores, your clinical experiences, and other things. So don't worry at this point if you have just one research experience. People do match without research, so it's not that research is essential, but everything counts. As long as other things in the profile are well done, you should be fine. Let's see. Yes, thank you all. And yes, Dr. Watts is our regular speaker, so we hope to have her back in the next few months. Home country residency, applying to different specialty, how is that perceived? So again, it is not a red flag because a lot of IMGs do residencies in, say, ophtha or derm or other specialties which are very hard to get for IMGs here. So it's not a red flag. What you have to do is you have to talk about the skills that you gained as part of that residency that you will apply here. So whether it's patient counseling or, like I said, working with teams, all those kind of things, as long as you can convince them that the skills you have, the 3 or 4 years you spent, are not wasted and you will use the same skills here, you should be fine. What type of visa should we apply for in order to do an elective? For most people, it should be B1, B2. So next question, interested in anesthesiology and want to know what makes a competitive IMG applicant. So anesthesiology, like some other competitive specialties, if you can do first electives, if you're not a graduate, always helps. High scores will always help. So think of ways to demonstrate interest in anesthesiology research, US research. If you can get a research position here, that will help. Some students who we have matched in anesthesiology every year. Home country residency tends to be an advantage in anesthesia. So if you have it, that could help you. Is it okay to send thank you emails and letters after the interview? A bit early for this question. We'll have more on this during the season, but yes, it is obviously okay to send thank you emails and letters. How will program see if we have a failed attempt? So I think Dr. Watts answered this question, and you can go back once we end to this YouTube video, and she explained it very well. If I have my MSP and transcript, but they are delayed to be uploaded, should I send them directly to the PD and PC? So I think they will all prefer all documents coming through IRAS, not really through email. So, that may just be a good idea. But depending on the delay, if it's going to be delayed by 15 days, probably. But otherwise, just wait for them to be uploaded. How is the official YOG gap calculated? So there is no rule per se. Different programs do it differently. Many programs do it from, say, the year of graduation, month and year of graduation, till, say, the September of the year you are applying. Some programs may actually do it from the month year you graduated till you start the residency. So there are these differences. But YOG is a soft filter. Many programs will overlook your YOG, if you have other parts of the profile which are very well done. Do I have a chance of matching in IM with low score and being a US IMG? So again, US IMG means you don't need visa, which always opens up more programs for you. If you have good clinical experiences, recent LORs, maybe less gaps, then yes, IM will open up for you. Is taking up a paid research program in the US and working on USMLEs, also shadowing doctors, a good thing to do? Yeah, if you get research positions in the US, that will always help you. How do programs go through the applications? I think Dr. Watts explained it, but what is the most common filter? So visa tends to be one filter, step one, and CK scores tend to be another filter. YOG, like I mentioned, is a soft filter. So when I say scores, attempts can come in. And does one person go through the entire application? So like Dr. Watts said, they distribute applications, so group of applications to different people. High scores, would it be 240 plus, 250 plus? Yes, high scores, I think 240 plus are reasonably high. How is the application affected by submitting a step 2 score a month later as a US IMG? So it could have a profound impact, depending again on your step 1 year of graduation. Many programs will wait for your step 2 to see if they want to invite you, but then you have to balance it because they may have run out of spots by that time. So it's a difficult decision. Step 2 CK is important. They typically will wait for it. And of course, for those of you who are interested in interview prep, we've started our interview preparation. Look up our courses on interview prep. So it's classes and, mock interviews for those of you who may be interested in preparing with us. I'll probably have my ECFMG certificates after 10 days. Then I can submit my RAS application. Well, you can submit it on 29th itself, and then chase the programs, telling them that you will get your certification later. What is a good step 1 score and step 2 for US IMGs applying into IM residency? Like I said, 240 is a good score, step 1 CK. What kind of profile gets interviews in the first wave? So first wave, typically you will see start 30th September, 1st October, people will start getting interviews. Recent graduates, high scores, relevant LORs, those kind of things will get interviews in the first wave for IMG friendly specialties. Now, ortho, derm, and all that are different. Some programs will wait for the AMG MSPEs to be released if they are an AMG heavy program. So many university programs will wait, but otherwise community programs will send out in the first wave. Recent graduates, maybe visa status, visa not needed, high scorers. That is the trend over the years. IMG with a 250 plus 250 in both steps with a low step 3, will it be a red flag? No, not really. I mean, 250 in both steps, step 1 and CK is a good score. So, but I won't say just passing it is enough. If you haven't taken it, make sure to get as good a score as you can in step 3. Our students recently have had 265, 255. So step 3 is also becoming some kind of not a filter, but programs are starting to look at it. Yes, season is stressful. So hopefully these webinars are helping. Is it better to submit a 3-year-old LOR or no LOR? Well, you are allowed 4. So if the 4th LOR is a 3-year-old LOR, why not go ahead and submit it? Step 3 score for an old IMG. We have an old IMG with a 268 step 3. Like I said, a 3-digit score as high as possible is a good one. How can we get research positions? You will have to directly, if you are looking for positions in, say, Cleveland Clinic, Harvard, Hopkins, Mayo, directly look for the faculty, look at their research interest, send out emails. We have separate classes on that for our students. So you can, but that's the main goal. Where can I get a list of IMG friendly IM programs? So there are a lot of lists floating on Facebook, the group that we run. But remember, your best source, if you're not our student, tends to be Frida and Residency Explorer. That gives you an initial cut, then maybe program website. For our students, we have a list as well. But otherwise, I don't think you need to pay for these lists. Other questions that you may have? Well, okay. If you have no other questions, let us know how we can help you in your interview preparation. We are just getting started. So classes, mock interviews, anything you need, we are there to help you. And then, of course, we'll have these sessions monthly, and you can get more information on our YouTube sessions as well. Okay, and we will have more sessions on program outreach and emails and how do you reach out to the programs, maybe in about 2 weeks. So good luck to all of you. Hope you all submit your applications on time. And if you're our student, we'll carry on this conversation in our Telegram group. So thank you, everyone. Have a good weekend.